Okay, good morning, everybody. My name is Sergeant Jason Robillard. I'm a Media Relations Officer with the Vancouver Police Department. I want to thank you all for coming this morning. We're pleased to announce a new joint rescue task force, which is a new initiative between the Vancouver Police Department, the Vancouver Fire Rescue Services, BC Emergency Health Services, and ECOM. And this is all focused on a coordinated approach to training, responding to active, deadly threat situations. Some guests behind me on stage, and I'd like to acknowledge and introduce them. First, we have Superintendent Steve Ely from the Vancouver Police Department, Captain Jonathan Gormick behind me from the Vancouver Fire Rescue Service, Andrew Kang, Director of Patient Care Delivery, BC Emergency Health Services, Aaron Ramsey, Vice President of Operations at ECOM, and Sergeant James Fluelling, Vancouver Police Department Emergency Response Team. Speaking to you today will be Vancouver Police Superintendent Steve Ely, followed by Vancouver Fire Rescue Service Captain Jonathan Gormick. As you can see up here, we have some visuals playing, and we'll be looping this video throughout the press conference today. What it is, it's a simulated video of training between the Vancouver Police Department, Vancouver Fire and Rescue Service, working together in reality-based training, which is the focus of why we're here today. All the actors involved have been trained to participate in simulated reality-based training. Also, there will be B-roll available online. If you'd like to speak to any of the guests, they'll be available after. I just ask that you save your questions till we've done the announcement. I'll also be available for any questions unrelated to today. I'll be here after. Thank you. Superintendent?
Thank you. Good morning. I'm here today to tell you about a new rescue task force initiated by the Vancouver Police Department in partnership with Vancouver Fire Rescue Services, BC Emergency Health Services, and ECOM. The purpose of the rescue task force is to deploy a coordinated, unified response between emergency service providers if and when an active deadly threat situation unfolds. The term active deadly threat refers to an assailant who is actively engaged in trying to kill innocent people with a weapon. That weapon could be a gun, knife, vehicle, or anything else that can be used to hurt people. The attack can happen in an enclosed public place, like an office building or shopping mall, or in an open outdoor space like a busy intersection. This April will mark the 20th anniversary of the Columbine High School shooting in Colorado. That event caused police agencies across North America and beyond to train their members in timely intervention tactics. The VPD's training has evolved significantly since that time. We have continuously examined the lessons learned from active deadly threat events occurring nationally and internationally. We have taken a number of steps to improve our operational readiness, but we saw an opportunity to further improve our response protocols. During an active deadly threat event, the VPD's top priority will always be stopping the threat. But if we coordinate better with our emergency service partners, there's an opportunity to treat and transport the wounded in a more timely manner, and that will ultimately save lives. With this new model, our rescue task force, the police will continue to assume responsibility for addressing active deadly threats, but we will now work with our firefighters to stabilize and extract wounded people to designated points where our partners from BCEHS can do what they do best, treat and transport. Collectively, our coordinated responses with critical communication support provided through ECOM will significantly enhance our public safety efforts. To date, upwards of 700 Vancouver Police and 400 Vancouver Fire Rescue Service members have been trained through classroom instruction and reality-based simulations. We are committed to working with our emergency service partners to ensure this training carries forward and forms part of our recurring training regimens. Further, we have shared the model and training with other police agencies in BC, and if requested, would be happy to serve as a resource to assist in a wider rollout. We know that active deadly threat event attacks are rare in Canada, but emergency service providers must prepare for that possibility. This sort of initiative doesn't happen without significant commitment from all stakeholders. I would like to extend thanks to a number of partners, starting with two who couldn't make it today. Chief Reed with Vancouver Fire Rescue Services and his command staff for their support and can-do attitude, and Dr. Eric Vu for his guidance and expertise. And a big thank you to our partners in the room today. Andrew Kang, Director at BCHS, thank you for your consultation and commitment to patient care. ECOM for stepping up to provide critical support and coordination. Aaron Ramsey, VP of Operations, is here today. Thank you. And finally, Sergeant James Flewelling with the VPD, who played a lead role in seeing this initiative to fruition. Thank you.
Thank you. This is an exciting time for Vancouver Fire Rescue Services. We're extremely fortunate to be in an environment where the advantages of agencies working as integrated teams are being used to provide safer communities across Vancouver. The days of public safety issues being delineated into law enforcement, pre-hospital care, and fire rescue are in the past, as is the antiquated notion that our services are somehow competing. The advantages of training and working together in composite teams have already been clearly evidenced by Canada Taskforce 1 and the city's public safety unit. Each agency brings skills, knowledge, and perspective, and we not only fill the gaps in each other's capacity, but together provide a faster, safer, and more effective intervention than could be done operating independently. Over the course of 2 months, more than half of VFRS firefighters and officers completed the intensive Rescue Task Force training, delivered by the VPD's tactical experts and Dr. Eric Vu. Training that polished our critical trauma skills, but centered around interagency communications, interoperability, and refined the capacity to work seamlessly in small teams under intense pressure with colleagues we may have never met. It's tragic that so much evidence exists, but there's a clear relationship between rapid patient access and large jumps in overall survivability during active threats. Any implication that initiatives like Rescue Task Force are fear-mongering or addressing a non-existent threat fail to recognize the reality of modern public safety thinking. Every one of us hopes that Rescue Task Force never needs to be deployed. However, an active threat is just one of several low-frequency but high-consequence risks for the city, and it's our service's obligation to those we serve to prepare, plan, train, and be positioned to respond swiftly and with the same effectiveness as we do for our everyday incidents.
Okay, thank you. I'll open up to any questions you have, and I'll do my best to facilitate the most appropriate panel member here. So any questions?
Can you give us a sense of what we're seeing in the video in terms of what firefighters are wearing, the equipment they're carrying, and kind of the training they've gone through to get to this point?
Sure. Would you like to speak to that, or? Sure. It's probably a joint.
Yeah, it's a bit of a
that's
joint. So what you're seeing here is, and as I stated in my delivery, the primary responsibility and role for VPD in the first instance, our priority is always stopping the threat. Members will be deployed for that purpose. But if we have a number of casualties that you're seeing in the video here, our members will provide overwatch, escort, and fire, who are there to stop critical bleeds and extract to a casualty collection point where EHS will treat and transport. So what you're seeing here is new equipment for the Vancouver Fire members. They've got helmets in place, they've got specific trauma plates, and they're highly identifiable by way of their vest there. So they form a critical part of Rescue Task Force, and they will always be working in partnership with VPD just to ensure safety.
Before this training actually occurred, how long would it take to get medical aid to injured people on the ground?
Typically, I mean, the numbers vary wildly from incident to incident, but typically in the past, and you've seen it in some of the events that unfolded in other countries, really EHS and fire were looking for an all clear before they could enter the scene. We were trying to find a way to mitigate risk, but provide more timely intervention, and that's what this is about.
How long can it take for police to be able to give that all clear previously to this training?
That's a really difficult question to answer. It varies by incident. James, do you have a thought on that? Or?
There's no specific timeline. The times vary, but the track record has not been great. As you've seen through several worldwide incidents, because these procedures were not in effect before, it would take sometimes several minutes, hours, to get medical intervention in, and of course that critical care is important in the first few minutes, and it wasn't happening, and it's simply because we didn't have these programs and there wasn't a protocol in place. So we're seeing that across North America, that change starting to happen, and we're seeing it here, and the response time difference would be much faster.
I've heard reports that from elsewhere in North America that people have basically bled out because they've had treatable injuries but haven't been able to get the medical
Yes, that's
treatment
correct.
while police are trying to ensure the safety of the the other medical first responders.
Yeah, that's correct, and that's that was the findings of the Hartford consensus out of the U.S. that one of the key causes of death after immediate trauma from the assailant was blood loss, and that happens in minutes. So we really need to get in there really fast to stop that and get those patients to definitive care.
So, can anyone explain right now the most difficult part for those emergency service to be delivered and to save lives? So, what are those major difficulties right now when something like this happens?
It sounds like a bit of a two-part question. What I'll do is I'll ask Captain Gormick to come up and address that from a fire perspective.
I mean, to add to what was said previously, the difficulties before were getting prompt medical aid and pre-hospital care to patients before they suffered life-threatening injuries or bled out because of their injuries. Those have been addressed by getting our staff in with the help of BPD to quickly assess and extricate and do rapid treatment on those that have suffered critical wounds and extricate them to a point that's safe where BC Ambulance can provide a higher level of care and then obviously transport them to hospital. I'll leave it to VPD to talk more about the difficulties of the chaos of the scene of this type of incident.
Thank you. Yeah, to answer your question, I would add, I think one of the biggest hurdles was getting commitment or buy-in from the different stakeholders you see in the room here to look at a different model. And we were very happy to see everybody involved was open to the model. And from there, it was the challenge was training massive amounts of members. So that was undertaken from October to December, and that's how we trained upwards of 700 frontline VPD members and 400 Vancouver Fire and Rescue. That training will be ongoing and repeated in intervals through our cycle training programs. I would entirely agree that if and when one of these events unfold, it will be chaotic. That's why we train our members proactively, so they know the protocols, they know the plan, and when certain members recognize an active deadly threat event unfolding with mass casualties, they know how to initiate these protocols, and it should work very well.
Regarding training, are the people right now that are trained for dealing with radiological and biological attacks, just in case this happens in BC or Vancouver?
Hand that to you.
Sure. That's, I would say, dealing with CBRNE attacks is outside the scope of Rescue Taskforce, but Vancouver Fire Rescue Services has a highly trained hazardous materials response team that has elevated levels of CBRNE capability and response. A lot of it post-Olympics because of the funding we received, but we've been able to maintain that and are well positioned to address any kind of attack like that.
Jonathan, can you give us a sense of deployment, how that's going to work, where the threshold is, if every firefighter who's trained is going to have this equipment with them all the time, and how that works?
Absolutely. I imagine the overall plan is to train every single firefighter. I think training half of our staff in 2 months is a notable accomplishment, and the plan is to run more training situations. Unfortunately, the tactical equipment is not personal, so there are caches of it deployed throughout the city in strategic locations, just so that we're prepared to respond no matter where the threat is.
Can I ask you, what is your sort of estimate of what the next sort of attack, or where it's going to be terrorists, it's going to be gangs? What you guys are expecting? What you guys are preparing for right now?
Just to make it easier, if you have a question, maybe direct it to a panel member. Would you like a response from a police perspective? Or?
I can answer, because I don't know how you guys are exactly dividing this responsibility of how. What are your expectations? But when you went to plan this beautiful organizing that you guys have done, what was the thought behind it? What are you guys, our really goal is, what you're preparing for? What are your expectations are for future, according to statistics that you guys have?
For an active deadly threat situation. So
yeah.
I'll turn it over to Superintendent Steve.
Yeah.
Thank you.
So I mentioned it briefly, but we really have taken the time to look at the lessons learned in a multitude of critical incident and active deadly threat locally, nationally, and internationally. James Falwelling and Dr. Vu have played a lead role in that. We really have evolved our tactics over the last 20 years since Columbine. It was the birth of immediate rapid deployment tactics, specifically since 2016, we've really made a concerted effort to improve our operational readiness. Some of what we've done is we've tested ourselves considerably through exercises like Cerberus 1 and 2 with our partners from multiple agencies across the province. We ran the largest preparedness exercise VPD's ever run, Exercise Vanguard, in late 2016. It confirmed a lot of the lessons learned in the national and international events, so we knew we were on the right track with what needed to happen. This rescue task force concept was a key piece that would provide us some operational readiness. We have a tactical medic program we've rolled out. We've provided mass casualty training to all our frontline members and equipped them properly. We've developed a run, hide, fight video to provide public guidance on what they can do if active deadly threat events come to their workplace or in the public. We've blended our command models to make sure we're in a position to deal with not just public order events, but tactical challenges as well when they come up at large-scale events. We have counterterrorism information officers. We have, I won't go into the details, but a lot of proactive intelligence going on with our stakeholders internationally and nationally. And we're working with community partners to try and make sure that if we come to a specific location that we're better equipped to access a threat quickly. So to answer your question, hopefully that gives you some idea of what we're preparing for. But really, it's important that we be prepared for everything, and that's what we're doing.
What are your expectations from public in case of an event like that? How can the public best help you guys?
You know what? I would basically probably direct you to that Run, Hide, Fight video that is on our public website. That's how they can help themselves. And then we will basically be, there's some direction in there also, like very specific direction on what they can do if and when the police attend for an active deadly threat event.
Superintendent, can you give me an example or two, local example if you can, where this may have made a difference, something you looked at?
I wouldn't want to try and cast negative judgment on something that's already occurred, but just some of the recent events locally and nationally. In Vancouver, February 2013, we had a random stabbing spree in the West End in an apartment complex there. Just regionally, 2017, September, in Edmonton, there was a vehicle and knife attack. April 2018, Toronto van attack. We've had in June of 2018 a shooting at Danforth Avenue in Toronto, Quebec mosque shooting in January of 17, and of course the Parliament Hill attack in September 2014. We had a Science World scenario as well where an active shooter shot a former boss and led to a bit of a gunfight, and ultimately that party was taken into custody. So there's enough events occurring locally, nationally, and internationally that really call for this kind of preparedness, and that's what's driving us right now.
Thank you. Okay, thank you very much for coming today, and we'll take a short break here, and I'll come back momentarily. If you have any questions unrelated today, I'm happy to take those, but thanks again for coming.